Welcome to the Care Navigator New User Training. The training is 4 modules, and all modules must be completed to retain Care Navigator access. We will start with our first module, a presentation that will focus on OneCare Vermont and the Care Navigator system. OneCare Vermont is an accountable care organization that joins together an extensive statewide network of providers and communities implementing healthcare payment reform and population health management under Vermont's all-payer model approach to health reform. OneCare is a voluntary network of healthcare providers working towards the quadruple aim to improve the health of patients, provide higher quality of care, lower healthcare expenditures, and provide greater coordination of care for Vermonters.
OneCare is an accountable care organization, including organizations across the spectrum of continuum of care providers. OneCare has contracted relationships with Medicare, Medicaid, and commercial insurance programs. It is comprised of an extensive network of primary and specialty care members, hospitals, post-acute care facilities, and other healthcare stakeholders. Because complex care coordination is an important part of achieving health outcomes for our population, we are aligned together around the care coordination vision, which is to provide high-quality, person-centered, community-based care coordination services in an integrated delivery system to achieve optimal health outcomes. We are committed to making the valuable work of care coordination visible and to bringing additional resources and tools to our community care coordination team so that together we can improve health outcomes and quality for the patients we serve.
Our population health model includes 4 stratified care coordination risk levels. Level 1 are low-risk individuals looking to focus on maintaining health through preventative care and wellness activities. Level 2 are medium-risk individuals with rising risk. The focus for these patients will be preventive care and assessment for early onset of stable chronic disease management. Level 3 are high-risk individuals with a full onset of a chronic condition and a need to focus on engagement in care coordination activities. The patient should have a care team created and a shared care plan developed. Level 4 are very high-risk individuals with acute and complex medical and social issues. Create a care team and engage the patient in the development of a shared care plan with action planning and task prioritization. The ideal outcome of our joint care coordination vision is truly person-centered, integrated care coordination in the form of shared care. Shared care means that all care team members are equal partners at the table regardless of their role in the organization, and that it is the patient who is at the center and driving the process. Our role as a professional in shared care is to gather and share information across a team to facilitate the patient achieving their own health and life goals.
Care Navigator is designed to address a variety of challenges that currently exist in the care coordination process. For example, communication is often fragmented as we work within our own separate records and systems that don't talk to each other. Transitions of care are not always well coordinated when all members of the patient's team are not equally informed or up to date as to the patient's status. Additionally, an absence of information that helps us understand which patients are most at risk for complexity of care reduces our ability to be proactive in engaging higher risk individuals to prevent avoidable emergency department visits and inpatient stays. These challenges and others can result in inefficiencies, duplication, and lack of continuity of care, with the end result being the health system doesn't meet our patients' needs. Care Navigator is a secure management software designed to improve coordination of care and increase alignment of the teams providing complex care coordination. It is a secure care coordination communication platform and is a HIPAA-compliant system that meets the minimum necessary rule and contains a 42 CFR Part 2 consent workflow. It is intended for use by individuals from organizations contracted with OneCare who are providing care coordination to attributed patients within the OneCare network. Care Navigator is a place to communicate key information across care teams about care coordination, activities, and shared patients. In a practice setting, staff who provide care coordination are the intended users. Care Navigator is not an EMR and is not intended for direct use by care providers such as primary care and specialty care physicians.
Congress has enacted a federal law to ensure that an individual's substance use disorder diagnosis, treatment, and referral information would be safeguarded and shared only for certain reasons specified in the law or with written consent. This legislation was enacted to protect individuals with a substance use disorder from discrimination associated with the social stigma of addiction and encourage those individuals to seek and stay in treatment programs. The Substance Use Disorder Confidentiality Law is implemented by federal regulations found at 42 CFR Part 2. Therefore, substance use disorder confidentiality laws are commonly referred to as Part 2 for short. There is a specific patient consent form and process in Care Navigator for Part 2 programs to ensure confidentiality of substance use disorder records and compliance with this process. Part 2 data may not be uploaded to Care Navigator unless a OneCare Part 2 consent form has been signed by the individual. Network members with questions on whether or not Part 2 applies to their organization and/or a patient's records should first consult with their organization's privacy officer, then reach out to OneCare for further assistance. Access to PHI varies within user roles based on HIPAA's minimum necessary rule, and access is based on the minimum amount of patient's information users need to accomplish the coordination of care for a specific population. Care Navigator is a web-based application. It contains confidential information protected by state and federal laws and regulations, including HIPAA. All care team members have contracted relationships with OneCare Vermont, and all Care Navigator users must follow information security safeguards, including safeguarding all paper and portable devices, using password protection and logging out, and appropriately disposing of patient information.
Start where you are at and reflect what you know by recording these 5 key steps in Care Navigator. What is the person's status? Enter the patient's level of engagement by recording the care coordination status. Who is on the care team? Add yourself and invite others who are involved with the care coordination of the patient. Add a lead care coordinator. This role will be filled by the person who has the most trusted relationship with the patient and is taking point in the development of the shared care plan. Enter care coordination activity by recording an encounter. Adding 2 goals with 2 associated tasks per goal. The goals should be broad and the tasks achievable so the patient feels success in meeting milestones to better their health. Next steps to take. Practice for 10 to 15 minutes at least twice in the week following your training, using your test patient and practice guide. Your test patient will be removed 1 week after your training date. Log into Care Navigator regularly to stay up to date with care team activity for your patients and remain familiar within the system. Accounts that have not been used in 90 days are deactivated and users are removed from patient care teams. Allowing your access to lapse impacts the care team communication as well as payments to your organization that result from your active participation on the care team. Identify 5 to 10 patients you're working with. Use the practice guide. Take steps to reflect what you already know about care coordination using the 5 key steps in the previous slide, such as adding yourself or others to the patient's care team, documenting a recent encounter, or adding the care plan goals and tasks. Talk with your leader about next steps for getting connected to patients or identify a patient if necessary.
Now that you are an active Care Navigator user, you will receive invitations to the monthly user group call occurring on the fourth Friday of each month. This call provides collective learning for users across the state with a different focus and unique information at each session. Receive information on new features, system enhancements, and participate in active discussions. Care Navigator has developed mobile and desktop applications which are available for more streamlined use. For more information related to these applications, please contact the help desk.
For questions or functionality issues in the Care Navigator system, contact the help desk. For ongoing community outreach and engagement, email OneCare Care Coordination inquiries. For additional Care Navigator support and resources, visit the OneCare Vermont website. Thank you for listening to the Care Navigator new user presentation. Please proceed to Module 2, the Care Navigator System Overview.